Ladies and gentlemen, I'm your Dr. Larry Burchett, MD, and welcome to your COVID Weekly, powered by Averpoint.com for September 22nd, 2020. This week, let's talk vaccines. It's been in the news. We're going to cover what is a vaccine? How does it work? How is it going to help us end COVID, get life back to normal, save lives? How do you develop a vaccine? What's the process, these clinical trials? How do we know if it's safe? What happened with AstraZeneca stopping their clinical trial with this transverse myelitis? What is all that? And how do vaccines work with DNA and RNA and the spike protein and coronavirus anatomy? We're going to review all of that. It's fascinating. I loved it. And make sure you watch through to the end. I'm going to tell you which conspiracy theory we're going to talk about next week. As always, please give your comments below. Let's take a step back. We got into this last week with the video on when is COVID going to end? And the answer is COVID's going to end when we have enough immunity in the population that the virus doesn't have anywhere to go and it goes away. There's two ways to get immunity. Everybody gets it naturally. 70% of people. If that happened, millions of Americans would die. That's not acceptable, morally unacceptable. Way too many deaths. The only other way to get to immunity where COVID goes away is a vaccine. And so that's why it holds the specific significance of develop a vaccine, deploy one that's safe, that works, that people take. COVID would go down in time. Some have estimated if things go well by the end of 2021. Watch that other video to get more into that. But what is a vaccine and how could it work with COVID? What are the kind of vaccines that were under development right now? This is fascinating. What happens when you get an infection, right? You get an infection, your body fights it off, and then it develops antibodies. So that if you get infected again, you've got these white blood cells that are ready to attack and initiate an immune response and get rid of the infection so that you don't even get sick the second time. What if you could just have the immunity from the beginning and you didn't have to get sick to go through the process of developing the antibodies? That'd be great, right? That's what a vaccine does. And specifically these antibodies. Let's talk about that for a minute. What is an antibody? Do you know? Looks like a little Y-shaped protein. And an antibody is part of the immune system that recognizes a foreign invader, something that is not native to your body, in your system, your blood, and it binds onto it. Now, antibodies don't directly kill viruses, for example. They're like a magnet that zaps onto them, and then they call in the cavalry. So they call in this complement system, which raises inflammation, sends other kinds of white blood cells. Some of them literally engulf the virus. Some lyse the virus and break it up. There's other kind of killer cells in the immune system. But the antibody plays this key role of activating all this stuff. And then two, memory. It's the thing that remembers, oh, this is the flu from last year that I've been exposed to again. We've got these antibodies sitting. They deploy, they jump on it. You don't get sick because either you've got natural immunity or you got a flu shot and it worked. So what are the way? Okay, so that's the key part of this thing that I want to impress on you is that part of the memory of your immune system is through these antibodies, okay? They're called immunoglobulins, IgM, IgG, maybe you've heard about that. One of the tests, the blood test, to see if you've had coronavirus, they check the antibody levels and see, do you have an antibody, IgG or IgM, to coronavirus that suggests, this would be COVID-19, that you had it previously? In other words, that you got the infection and your body produced these antibodies. People that do have those, that's how we give the treatment convalescent plasma. The thinking is, well, if we just gave them the antibodies, that would somehow bind the virus, help them get better. The studies are a little inconclusive, I think, about whether that really benefits or not. But that's the idea behind that, and it's all about the antibodies. So that's the whole purpose of the vaccination, is to produce antibodies. So how does it happen? What do we do with the vaccine? What do we inject that leads to antibodies going up so that they're ready to fight and respond to coronavirus, for example. This stuff is fascinating. So let's just pause for a second, review virus, or in this case, coronavirus anatomy. It's very simple. Protein sphere. It's like this ball, this protein. It's got a little spike protein on there. That's how it attaches to the ACE2 receptor. We've talked about that before in this series. Coronavirus has this, spike protein's been known since 2002-3 with the SARS coronavirus back then in Hong Kong. That's how it gets in. And so that thing gets in, coronavirus gets in the system, wreaks all the havoc, does all that stuff. So most of the vaccines, your your antibodies usually bind to a surface part of the virus. This S protein is great for a couple reasons. One, it's available in the virus. And two, if you can bind to it, you can block how the virus attaches to our cells and gets in. So that's the main target on the coronavirus anatomy that we want to get antibodies to. So the question then becomes, what are the different ways where you can give a vaccine that will make antibodies to this spike protein? And this is where the science gets really, really interesting. Kind of excited to review this with you. So one thing is, it's like, well, what if we took coronavirus and you just killed it, you heated it up to too much, and you still got these kind of literally dead virus particles, and you just injected those as a vaccine? For sure. That's one of the ways that vaccines are being injected with a dead virus. That's called an inactivated virus. And we've got other vaccines that work like that. That's the flu vaccine, polio, hepatitis A. You take dead flu, inject it in somebody, their immune system develops antibodies. And in the case of the flu, you hope that you predicted right, that that's the right flu that's coming. That's an inactivated vaccine. And there are some for coronavirus that are using that way. You can also take a virus and weaken it, kind of cripple it. It's not totally dead. You inject that, same thing. You generate this antibody immune response. That's measles, MMR, smallpox, and chickenpox. That's how those vaccines work. And there are some that are doing this for coronavirus as well that are in development. Now, here's where this stuff gets interesting. And this was fascinating to me. So this AstraZeneca one, which is at this point is still in stage 3 of the clinical trials. We're going to talk about what clinical trials are in just a second. It's a viral vector of a vaccine. Now, what does that mean? This is fascinating. So they take this spike protein and they put it in a virus, like kind of a benign cold virus, and they modify it so it doesn't make you sick. But they literally inject you with a benign, safe virus that replicates a little bit and releases, instead of releasing a virus that can make you sick, it just releases this S protein. So that spike protein is in your system, and the same process happens. Your body identifies it as foreign, creates antibodies, and then now has all of these antibodies ready for coronavirus, and you haven't had to go through the risk of getting sick, potentially ending up on a ventilator, having all of these complications of getting real COVID. Bam, you've just got that. But it's fascinating, right? They package the protein in a virus and then use the virus to replicate in your body. Oh, it's fascinating, right? I think that's incredible. That's like genius. Now, there's another one where, and you can combine these two. So again, that one was called a viral vector, where the virus is the vector. The virus carries that little protein into your body, and that's the vaccine. And it's safe. I know it sounds crazy, but it's safe. So another way is, instead of using this viral method, you take, and this is crazy too, you take the DNA or RNA, you take the genetic material of coronavirus that creates this spike protein, and you inject that, and you get that into the human cells, and our own cellular machinery produces not the whole coronavirus, so it's not the whole thing that's going to infect us and get us sick. It just produces that little S protein, that little spike protein. So it uses either DNA or RNA, it gets into our cell, our nucleus, and it uses our own cell's machinery to produce this spike protein again that is released into the system And the same process happens. The body identifies it as foreign. Even though we made it, it's still a foreign protein. Antibodies get built up. You're ready for when the real virus that can attack, kill your cells, cause respiratory failure, all these problems comes. These antibodies move in, block it, call everybody, shut it down, that whole process. Fascinating, right? Like you can use a virus, you can use the virus's DNA and RNA. It's incredible. Those last two, the viral vector and there's an mRNA virus, or the mRNA vaccine with Moderna and Pfizer, those appear to be some of the ones that are farther along in the clinical trials and might be the way, they might be the vaccine or some of the vaccines that we use. So let's talk for just a second about, what is the ideal vaccine? So the ideal vaccine is going to be something that obviously, number one, is safe. We're going to talk about clinical trials in a second, and effective. Those two things are what clinical trials need to demonstrate, that it's not going to hurt people, do no harm. And number two, that it's going to work. But then also, what else do we need? Well, we need to be able to mass produce it. In this country, tens, hundreds of millions of people. Some of these vaccines take 2 doses. So if you have 100 million vaccines, that's only 50 million people that it covers. It's incredible, right? Like when you're talking about scale. So not only does it have to be safe, work, you have to be able to mass produce it. We're talking about the timeline. So you can't compromise on if it's effective and safe, but it also can't take years to cook up in the lab or it's not going to be useful. So these are the kind of things that, that's why it's not just one kind of vaccine that's coming out. It's like weighing all this. Which one's the most effective? Well, this one can be mass produced. And what are we going to do for, the billion people in China and all this kind of stuff? So worldwide, this is where different approaches are going to lead to probably multiple solutions for this problem. So pay attention a little bit. Now you know a little bit about the type of vaccine. Oh, is it a DNA RNA vaccine? Oh, is it a viral vector? Oh, is it just injecting the protein? Is it a dead coronavirus? All these different kinds of vaccines. Now let's talk for just a second. When is this vaccine going to come out? So the process of developing a vaccine, also fascinating, normally takes years, 5 to 10 years. Crazy. Before you test it on people, you want to know a couple things. One, the main thing that you want to know first is, does the way that you're doing the vaccine, including what you're targeting and how you're doing it, like all those things we just talked about, does it induce an immune response? In other words, does it create antibodies? Number one, does it create it in cells in a petri dish? 2, does it create it in animals? You want to know, before we're using this on people, does it work in mice? Does it create, once you see, oh, we inject this certain vaccine in this particular way, and what we see and observe in animal models is that there is an immune response where, other mammalian immunoglobulins go up, and you get to a certain point of that. This is before you even trial on humans. Once you get to human trials, there's 4 stages, stage 1, 2, 3, and 4, okay? A lot of these are some are in stage 3 right now. Once you get through stage 3, you can distribute it widely and send it for FDA approval. Stage 4 is just ongoing monitoring once it's out there. So stage 1, 2, and 3 are the clinical trials. Stage 1, it's the first test on human beings, and you test it on healthy people. And you're testing, again, the same 2 things. You want to make sure it's safe and that it works, meaning it gets an immune response, that you develop immunoglobulins, antibodies, IgM, IgG results. They go up from you doing your vaccine. That's one. That's stage 1 clinical trial is typically less than 100 people. Once you demonstrate that, you go to stage 2. That's more, that's in the hundreds. So let's say you get 500 people. You want to start looking at an exact dose. You still are checking for safety to make sure there aren't any adverse events, that it's safe. And then 2, does this dose result in how much antibody and how much antibody level is needed? Do you need 2 doses? All of these kind of things start going on. Stage 3, you blow it up more. So the AstraZeneca trial that was in the news, that was of 30,000 people that volunteered for this thing. But same thing. So they want a spectrum of people, young and old. You want to see when you're doing this, how does it affect old people with multiple medical problems, etc. Is it safe? Does it result in an increase of antibodies, of immunoglobulins? Now, it's assumed that if you generate an antibody response, that those antibodies then will be protective against coronavirus. That is a little bit of an assumption there, right? But you can't, it would be unethical in the process to subject people intentionally to getting sick of COVID, right? Somebody would end up dying from it. So that's kind of the best you can do. And in general, in vaccine science, that holds true. But it is another assumption in the mix. So that's the clinical trials, 1, 2, and 3. There are some that look like they're going to have results through stage 3, kind of at the end of the year, November, December. Once you get through stage 3, there's still, so stage 1 typically takes months, stage 2 can take a couple years, stage 3 can take years. That thing can take 5 years just to get to the point where you can submit it to the FDA. And then that often takes a year. And there's all this red tape. And so end of the year, November, December, you're going to see something that's approved, that's through stage 3 and is approved. They're going to push it as, FDA still has to look at it. Then it has to be manufactured. Then it has to be distributed. There's going to be so there'll be a little bit of a delay. You'll see this in the news. They'll talk about it. It'll start rolling out. Hang on just a second. I want to get into some of those issues in a minute. But so what happened with AstraZeneca, and they were in stage 3 clinical trials with their vaccine. And again, the AstraZeneca one, let me review this. I want to get this right. That was one of the viral vectors, okay, using the virus. Now, they stopped it. This was in the news for transverse myelitis. There was a case of transverse myelitis. They had 30,000 people. Somebody developed lower extremity neurologic symptoms like weakness, numbness. Transverse myelitis refers to your spinal cord. You see it on an MRI. You see this kind of transverse section that lights up. It corresponds with damage to the spinal cord, where people have symptoms that potentially could be permanent, from whatever the level of the spinal cord is down. You could end up in a wheelchair. It's incredibly serious. So they did the right thing. They pushed pause on the trial and they said, we need to answer the question, did this come from our study from this vaccine or not? There's an independent review board. They get in, they look at that, right? So in stage 3 clinical trials, not only is it 30,000 people, but you're giving half of them placebo. You're giving half of them something that doesn't work because you want to compare and demonstrate, hey, our vaccine absolutely works. It raises antibody levels, and the placebo one doesn't. You want to compare that to demonstrate that your thing actually works. So when somebody develops a complication, you look at it. Now, the study was blinded, so you didn't know, but it turned out that this person actually did get the vaccine. They analyzed everything, came to the conclusion, transverse myelitis, which is incredibly rare. It's like, looks at it was like 1 in a million, 4 in a million, incredibly rare. Concluded, and a lot of the way that you look at it, and it concluded that it was not due to the vaccine, and then they started the thing again. Now, you can blow this up and say, oh my gosh, this is why we shouldn't do vaccines. It's terrible. This caused it. But this is the way the system worked. The system worked, which is when you see something serious, you want to stop because we don't want to give anybody else that if it's going to hurt people that have volunteered for this. They stopped, they looked at it, and it's a complex statistical analysis to figure out, did this thing cause it or not? Because, think of it, let's say you have 30,000 people, some of them, unfortunately, are going to develop cancer. They're going to have strokes and heart attack because in 30,000 people, those diagnoses are going to happen. It's not that nothing happens, it's that do you see this happening way more in the people that got the vaccine versus didn't, or way more in the people that got the vaccine or in your trial versus the regular population? And so you look at all the risk and all that stuff and come to that conclusion. Now, I'm going to make an argument here that this process is going to be safe, and it's going to result in a vaccine that is reasonably safe for what we need it to be. And here's a couple reasons why. One, there's a review board that's independent of the pharmaceutical company. Okay, so it's separate from it. Pharmaceutical company has you say, well, the drug company has an invested interest to push this to make money. That's true. They do have an invested interest, but imagine if a big pharmaceutical company came out with a vaccine and months down the line, they have all of these complications from it, where people develop transverse myelitis or strokes or whatever, and they can pin it on the vaccine. It actually is the vaccine. That stock is going to go, pew! It's going to be crushed. They're not going to sell that vaccine anymore. That's a form of accountability, and that incentivizes this company not to just push it, get through, and make the short buck, but actually it's way more in their interest to develop a safe vaccine that isn't going to hurt people, that actually works. That's what's better for their long-term profit interest than a short-term thing where they tried to hide the results and they end up getting busted and it blows up. I think the system is going to produce a safe vaccine. Now, this is a caveat because this is an election year, and the president has hinted that he may use what's called an emergency authorization. So we've got this process that usually takes years, and they have literally called this Operation Warp Speed because people are dying of coronavirus. Like, we need to come up with a vaccine that's very real. I actually like the Operation Warp Speed to develop a vaccine. But it's got to work and it's got to be safe. You can't just release some crappy vaccine that hurts people. That's going to be counterproductive. And there's already year to year a growing problem with anti-vaccination, people not getting vaccines. Some vaccine preventable diseases are going up more and more. And so what a nightmare that would be for the country to come up with a vaccine that isn't safe. So many people are not going to get it to begin with. That would even be another step back, not just for the short term for us to get through COVID. We're going to need people to get vaccination to build up that herd immunity. But then looking forward, we would lose people to all of the benefits that vaccine, all the lives saved, the vaccine and the goods that vaccine does. So, like I said, stage 3 clinical trials, it looks like November, December, that'll come out, but there's still going to be more process. Probably not going to get a vaccine rolled out until sometime in 2021. There's an election coming up. Trump's hinted that, he might bypass all those regulations, and November 1st, a couple days before the election, use an emergency authorization for a vaccine. If that happens, look to the true medical experts. The former Surgeon General has been very vocal and clear on things, Fauci, et cetera. People will clarify whether this thing is safe or not, and then whether that's a good idea. That might be politics versus medicine. And what I want to impress on you is that this process, with its checks and balances and the safety, it's something that we can trust that it will result in, again, if it's not meddled with, you got to follow the scientists on this, not the politicians, okay? But if it's not meddled with, it is going to produce a vaccine that's reasonably safe, that's going to save millions of lives, and that's going to end this thing. So other things that you're going to see, November, December, something's going to come out. Eventually it'll roll out in 2021. Then we get into these ethical issues of who gets it, because there's not unlimited supply. You have to manufacture it. You have to produce it. You can't just do that. The capacity to do this is incredible. Then you have to distribute it. A lot of these vaccines have to be kept cold at certain temperatures. I remember when I was in Africa, vaccination over the whole continent wasn't realistic because some places didn't have electricity. They didn't have freezers. You would carry them in these ice, vaccinations. So there's a whole supply chain and distribution. There's a practical issue of, okay, we've got the vaccine. How much can we make? Who gets it? Women and children first. Not anymore. This is going to be elderly and sick, and then frontline medical workers. It's going to be prioritized. So that's that in this country. But what about worldwide? The United States is going to come up with a vaccine. Other countries are in this too, China, et cetera. Where does it go after that? How much are they paying? What if they can't pay? Now, I will say there is great hope about the amount of collaboration that's gone on internationally with studies, public, private, all this stuff has been inspiring. And I hope that it continues like this and doesn't go back to before researchers were kind of siloed in their own academic institutions and didn't share information as freely. This has been very collaborative, but there are ethical issues there. The United States, for example, gave $1.5 billion to Big Pharma, particularly Big Pharma, funding the development of the vaccine, and they said, we get the first 100 million doses. So who's going to get it next? And how is that going to play out in, global politics and health? So let's talk about China and Russia for a second. They have a vaccine that got through their kind of stage 2 clinical trials, and then they said, we're going to skip stage 3. We're just going to start putting it out there. I think most of us in medicine don't trust that process. Literally, they're skipping a step, which is passing on risk to whoever's going to get this vaccination. I don't trust that. You should feel better that in this country, we're not going to skip that step. It's going to take a little longer. That's part of the dilemma, but especially here, again, like I was saying before with the anti-vaxxers, we can't do that. All right, I think I've gone long enough. I'm going to tell you in a minute which conspiracy theory we're going to talk about next. That's how vaccination works. It's all about those antibodies, getting those antibodies. Whichever way we're getting that, whether it's a viral vector, whether we're dropping some DNA, RNA, whether we're putting the virus or whatever we're putting in, gets your immune system to do that. Enough people build up the immunity over the whole population. That's how COVID's going to go down, and we're going to get out of this thing. Hopefully this stuff continues to move forward. End of this year, we see a vaccine sometime in 2021. Produce enough of it in this country, and then share that so that throughout 2021 goes down here. Some have said throughout 2022 worldwide. That's the story. That's how vaccines work. It's all about those antibodies. So the science is brilliant. I loved that. I love learning about that viral, more about the viral vector and using that, or how dropping off a virus's DNA and using our own cellular machinery to produce their protein that then builds up our antibodies. That's genius. That stuff's genius. Okay, here's what we're going to talk about. Thank you for watching. Please check out the points of this. All the evidence is going to be laid out on Averpoint.com. Next week, we're going to talk about the COVID conspiracy theory of 5G. And if there's anything to that, being the cause of coronavirus. That's kind of one of the #1 conspiracy theories. Give me your comments below. Thank you if you got this far. As always, stay safe, stay sane, do your part. I'll see you next time.